I'm Jason Hochfelder. I'm an orthopedic surgeon at Northwell. I'll see patients with any type of hip or knee issue. I specialize in doing minimally invasive hip replacements as well as robotic assisted knee replacements. My interest in medicine started at an early age. I went to Johns Hopkins University in Baltimore for my undergrad. Then I went to NYU School of Medicine for medical school. I liked it so much, that's where I did my orthopedic training for 5 years. I grew up in Briarcliff, about 3 minutes from Phelps Hospital. So for me, it's all local. I see a lot of my parents' friends as my patients. I see some of my high school teachers, and I like taking care of the patients here because I have a connection to them. When my patients come to see me, their goal is to get rid of pain and restore their function. There's lots of ways to do that. Sometimes it can be something simple like rest or doing physical therapy. Sometimes we have to do injections, and sometimes we do surgery. For hip replacements, I primarily do them using what's called the anterior approach. This makes it much easier for us to take x-rays during the surgery and allows us to actually know exactly what the implants are going to look like before we even put one stitch in. In terms of knee replacements, using the robot that we use is really the best of both worlds to be more accurate and make sure the knee has perfect range of motion, good balance, and that the implants are aligned exactly how they're supposed to be. As a patient, when you're deciding where to go for a hip or knee replacement, the most important thing is that you're comfortable with the doctor. When you compare the care that you would get here in Westchester to the care that you might get at a big academic hospital in New York City, I think you're going to find that it's actually identical. Any of the equipment, any of the technology, we have that here. The same robot that you would have at that hospital, I have. In fact, I was actually the first doctor in Westchester County to do a robotic-assisted knee replacement 5 or 6 years ago. What I love most about the work that I do is seeing my patients so happy. A week or two ago, I had a patient come give me a big bear hug and say, "Thanks for giving me my life back." I've had people send me videos of them on jet skis. Just really getting people back to the quality of life and doing the things that they want to do is really the most rewarding part.